Debbie Seidel-Vicky, and welcome back to our 5-star dental hygiene care videos for the month of July. This week I'm talking about the doctor hygiene exam, and I have a specific way that I like to suggest our clients complete the doctor hygiene exam. I have 2 or 3 tips that I'm going to share with you today. One of them has to do with rapport building and also proxemics. So I'll explain to you now how that works. At this point in time, it is probably 25-30 minutes into the dental hygiene appointment, and the hygienist will just slide out of their chair and go to the other side of the patient. Now, I wanted to make mention that 2 things. I really like that the doctor has a mask on, but not over his mouth. I have seen it many times where the doctor's talking to the patient with a mask over the mouth, and it's really great that the doctor came in, there's no mask over his mouth, and they're just having some small chit chat, as you can see. The hygienist just goes to their side, and one thing I want to mention about this side, this isn't the perfect scenario here. The hygienist hopefully still has their gloves on, and they just step over to the other side of the patient. The patient's going to have a bib on, and at this point in time, the patient does not need to be sitting upright in the chair, unless, however, it's the first time doctor's meeting the patient. And it looks like in this slide here that we probably have a new patient, and doctor's coming in to meet the patient for the first time. So like I've talked about, if you watch the other videos, when you're first seated with your patient, especially when doctor hasn't met the patient, it's really great if doctor can come in and the hygienist has introduced the patient to the doctor, and we're not treating them like a patient, but just getting to know them as a human being. And that's what I think is going on here. But I'm using this as an example because the hygienist is on the other side of the patient. And this is what's going to happen in the doctor hygiene exam, is that the hygienist gets up, moves to the other side of the patient, and the patient is still in a supine position. Now, this is Proxemics, and I wanted to mention this because this is really great. Not only is rapport building just with the chit-chat, catching up, the hygienist will lead the doctor through some, maybe it's summertime, there are a lot of weddings going on, maybe that patient in the chair has a daughter or son that's getting married, and the hygienist will let the Dr. Goodtooth, Mary's daughter's getting married in 2 weeks, and then doctor can say, oh, I remember Mary when she was just 5 years old. It's hard to believe she's getting married now. That's great. Where's the wedding going to be at? And blah, blah, blah. Now the patient's, still lying back in the chair. The doctor and the patient have already met. They've known each other for many years. So there's no need to sit that patient upright in the chair. Now, as you're looking at these pictures here, I want to make note that the doctor should be wearing a mask and glasses along with the patients. And these are just some pictures that I had on hand. So I want to make sure that if this is my client, the patient's going to have the goggles on, sunglasses preferably, and then the hygienist is still going to have their gloves on. Doctor is going to have a mask and probably some loops on at the same time. But as you can see, the hygienist, I want you to notice how the hygienist is here and the doctor's here. So we actually have, it's almost like a triangle here. And if the patient looks to her right, there's the doctor. If the hygienist is talking to doctor, which the hygienist should be leading doctor through what they have completed so far, that patient can move to the left. This is Proxemics. It's a comfortable knee to knee, eye to eye. The patient is not too close to the clinicians, not too far away, and they feel safe and just comfortable in this position. And that's what Proxemics is all about. It's a subliminal way to build rapport with your patient. So I wanted you to notice how the hygienist goes to the other side of the patient, and the patient can look to either side as the hygienist leads the doctor through something like first that rapport building, just catching up on something personal about the patient, and then explaining what was completed. Were there x-rays taken? Was there an oral cancer exam completed? Was that a negative, hopefully, or did you find a lesion? Was there a periodontal screening exam completed, and how does that exam compare to the previous exam? Were there any restorative needs that were discussed? And if the patient needs x-rays at the next visit, the hygienist is going to say, "Doctor, it will be a year since the last x-rays when Mary comes back in 6 months." And doctor says, "Perfect, I want to see those x-rays next time she's here." That really sinks into the patient's head that doctor said ahead of time, next time Mary comes back, doctor wants x-rays. Doctor will just agree, hopefully, because the hygienist and doctor are calibrated with what does the doctor consider a need for an implant or a crown or a bridge. And so the hygienist has taken the patient through this process. Last week we talked about using the intraoral camera, and those photographs taken from the intraoral camera are going to be present up on the computer screen so that doctor can review these with the patient as the hygienist leads doctor through this. Just a quick review, the exam will begin approximately 25, no later than 45 minutes into a 60-minute hygiene appointment. No more of the patient and the hygienist sitting and waiting for doctor to complete that exam. The patient will remain in a supine position unless that's a new patient. And I suggest that if it's a new patient, that doctor come in at the beginning, probably in the first 5 minutes, and greet that patient when there's not even a bib on the patient. That exam between the hygienist leading the doctor through the communication of what has been completed, what are the patient's needs, what did we see in the patient's mouth, should take no more than 5, at the very maximum 7 minutes. And it's in the beginning that doctor's just spending about 90 seconds of quick chit-chat. And that chit-chat is started by the hygienist, just updating the doctor on something personal with that patient. So it's the hygienist that's leading the doctor through that exam process, and hopefully the hygienist understands exactly what doctor would think needs to be completed for those different types of restorations the patient might need. These are just some great points to practice as a team so that you can get this down to a science, and it won't be a sit and wait for doctor, and the process is just streamlined to keep everybody running on time. Is this something new to you, or are you already completing the doctor hygiene exams in this way? I'd like to know how it's working for you, or if you're not doing this way, would this be helpful to you? And what other topics do you want to hear about? Next week, I will be talking about dismissal of the hygiene patient, so join me next week.